Today I'm doing a brief presentation on an educational pathway to medical coding. First, you may ask, what is medical coding? Well, medical coding involves assigning numbers to diagnoses and procedures, thus putting the medical terminology into codes that can be sent out to the insurance provider, which is ultimately how hospitals and physicians are reimbursed. One other purpose of coding is to collect clinical information from various healthcare visits so that providers who treat the patient a second time or again, they'll have the necessary information to provide the best possible care. There are different coding specialties that you may want to get into. Some examples include inpatient coding, which is in the acute care facility setting or long term care. There's outpatient coding, outpatient transfusion coding, ER coding, as well as physician based coding. Let's compare coding credentials. Coding credentials are extremely important in order to compete for jobs in your area in the HAM department. And many are posted in the Washington, D.C., Maryland metropolitan area, but a lot of them require that you are credentialed. The American Health Information Management Association offers the CCS and the CCSP. The CCS is the Certified Coding Specialist, and that's pretty much typically your inpatient professional coder. The CCSP, on the other hand, is your Certified Coding Specialist physician based, and you'll find that you're with that credential, you're doing outpatient coding, ER, ambulatory, and basically coding for physician practices, group practices. Also, we have the American Academy of Professional Coders, and they offer the CPC, the CPCH, the CPCP, and the CIRCC. The CPC is a Certified Professional Coder certification. The CPCH is the Certified Professional Coder Hospital Outpatient. And the CPCP is your Certified Professional Coder Payer. And the CIRCC is your Certified Interventional Radiology Cardiovascular Coder. So you may be asking, like I did when I first started my educational journey, which organization should you choose? Which is the best? And I'm often asked this question now, and I'm like, okay, I have to be honest. And to be totally honest with you, both organizations offer their members a ton of resources. The best credentials would be determined by what's in demand in your area. So, again, both organizations are well respected in the industry. So, what I suggest you do is search your local hospital job postings and see what the qualifications they're asking for as far as credentials. Are they asking for AHEMA credentials, or are they asking for AAPC credentials? Okay, now the certified exam, the coding certification exam requirements are that you're a high school graduate and you don't necessarily need a college degree for the coding certification. The college degree is necessary for your RHIT, which is your Registered Health Information Technician. Which is a credential that is offered from AHEMA, and we'll discuss that in a future presentation. Now, for your coding certification exam, AHEMA recommends at least 3 years on the job experience, while AAPC strongly recommends an associate degree. Is it possible to pass the coding exam without experience? I'm going to say yes. With a lot of dedication to studying the coding guidelines and practicing various coding case studies, you can, pass the test without having experience. The tools you'll need to succeed with this is you would need your coding books, your manuals, and they are updated every year in October. So you would need the ICD 9 CM. In a few more years, we'll be using ICD 10. You'll also need CPT, which is your current procedural terminology manual. It lists 5-digit numeric codes for reporting medical services and procedures performed by physicians. So this is pretty much used in your outpatient setting or your physician-based setting, whereas the ICD-9 is used in the hospital for inpatient coding, and that is your internal classification of diseases, ninth edition clinical modification, in case you were wondering what that acronym stood for. You will also need a HCPCS guide, which is the Healthcare Common Procedure Coding System that is used for Medicare coding. You will need HCPCS mostly with outpatient coding. Okay? Now, I recommend that you get, if you're going to study, without the help of a medical coding class, you can get Faye Brown's ICD 9 CM coding handbook. Faye Brown is highly regarded in the coding community, and there's a wealth of information to be found within that handbook. There's also the professional review guide that is offered, and I would recommend you use this as a guideline or as study practice towards your exam, your actual certification exam. This particular review guide is loaded with case studies. It has a mock exam where you can set your timer and take an exam. There's also a CD to help you, because a lot of folks, or some folks I should say, get stuck with the multiple choice questioning. So with the CD that is offered in the professional review guide, it allows for practice with an electronic multiple choice format. So I'm wishing you the best of luck on your educational pathway towards medical coding. And if you have any questions, feel free to contact me. I can be found on Facebook. I'm on Twitter now at tjonesccsp, and you can email me at tjonesccsp at AOL. Thanks again.